So good morning. This is Lyon Kimberly Haynes, and I would like to welcome you to the National Providers Networking meeting. While we are on the call, I'm asking everyone to please mute their phones, as well as to drop their name, organization, and email in the box. A recording of this meeting will be made available on YouTube. You can check the Family to Family YouTube page, or you can like and share and follow Illinois Family Wellness or Cope Cyber on Facebook for updates, as well as links to recorded meetings. In 1995, under the BH Consent Decree, the Illinois Department of Children and Family Services established 62 local area networks covering a specific geographic area to address the mental health and educational needs of children in care, as well as those children who are at risk of abuse and neglect. Land 53 covers the South Cook region and includes 4 townships, that is Bloom, Bremen, Rich, and Thornton townships. Collectively, those 4 townships cover 51 individual municipalities, 51 different mayors, police departments, park districts, school districts, and library boards. Through 2011, Land 53 was funded by the Department of Children and Family Services, the Illinois Department of Human Services, and the Illinois State Board of Education to provide wraparound services and a host of other family-centered services aimed at reducing truancy, suspension, and expulsion in this region. Right now, where we are today, LAND has reorganized, and we are looking at collaborating and leveraging our resources in order to improve access to strength-based programs, services, and advocacy, improving access to educational and mental health resources, and reestablishing our ability to provide wraparound services to the families that are in need and are not currently being serviced by traditional organizations in the area. We have an assessment work group that takes a look at the data that is available within this region. And what we're looking at is continuing to develop a Building Stronger Community Needs Assessment that really takes a look at the strengths of a community and allows us to operate from a strength-based perspective. Suzette Logan is our chair of the assessment work group. So if you would like to know more about that or to get involved, please contact Suzanne. We are also sponsored in part by the Lions Club International Foundation through our work with the Lions Quest Social and Emotional Learning Program, which provides curriculum, training, and materials and resources to support the implementation of evidence-based programs in our schools and community-based organizations. Please contact me if you are interested in bringing a virtual training to your school, to your district, or to your youth serving organization. We are, for a limited time, providing 5-year licenses for the online curriculum and student materials for up to 40 participants. The participants that will be able to implement a social and emotional learning program within their own organizations or schools. Today, we're really pleased to have with us Dr. Jennifer Geiger. Dr. Geiger is the assistant professor of the Jane Addams College of Social Work with the University of Illinois at Chicago. Dr. Geiger and Kelsey both work with us through the Jane Addams College of Social Work to help lands like ours understand the data and understand the needs of the children that we're serving. She is also the principal investigator with the Permanency Enhancement Project and covers the entire state. So I would like to give her the time. She's going to talk to us today about data that is being collected by the Department of Children and Family Services that I think is going to really be helpful in guiding what we do with our work and understanding how we can best organize to have the best impact for the youth and families in our communities. Once Dr. Geiger is done, we will allow some time to give a little bit of feedback for questions and discussions. So Dr. Geiger, I'm very pleased to have you with me this morning. I am going to stop sharing my screen, and I really would like to turn over the majority of this time for you and your presentation.
Thank you so much, Kimberly. It's such a pleasure for myself to be here today and to be able to present this information to you all. I'm hoping it'll be informative, and then we can have a discussion, as you mentioned, afterwards, where we can ask some questions and just maybe share some ideas. I should say, the data that we will be presenting, and I'll talk a little bit more about our project, kind of give an overview. DCFS collects a lot of data. We know that we don't always know kind of what happens with it or how it's used. I think it's used for a lot of different things. So this is really just a small part of the data that they do collect. My goal is, and mostly because this is the first time we'll be able to present it to the lands individually. In the past, at least since I've been working on this project, we've had the data for Cook County, but as many of you know, our communities are very different across even just Cook County in these different regions. So although this is a statewide initiative, Kelsey and I work specifically with Cook County region. So it's really exciting for us to be able to present the data that is very specific to your land, to your community, so that we can you all are the experts in your community, and you can maybe make sense of these data a little bit better and help us kind of share some ideas about like how can we use these data to best improve wraparound or different services, or how we're engaging community members in this sort of platform and this sort of gathering. So with that, let me just pull this up here. Everybody see that okay? Here, I see some nods. Okay, good. Okay, so huge thanks to Kelsey. You all know Kelsey, who has been very instrumental in helping me pull together these data presentations for all of the lands. So we actually are presenting to all the different lands and action teams that we've been working with over the course of this year. So hold on one second. Let me give you some information about our project. Ms. Haynes mentioned that we are part of the Permanency Enhancement Project, and Paula is also joining us today. Many of you know Paula, who is the administrator for this project as part of DCFS, but just to give you a little bit of background information, this initiative is statewide. It has been going on well over 10 years now and has evolved in different ways over the past 10 years. But really what we're doing right now is, as a project, we are supporting DCFS, or we're contracting with DCFS to be able to provide support and technical assistance to communities. So we talk about lands, we talk about action teams, it's kind of interchangeable sometimes depending on just the language that folks use. But these are different communities across Cook County that have come together. They all do very different things. So many of them come together, share information, and have these sort of networking events on a monthly basis. Others, they all have different kind of funding sources. Some may not have funding sources at the time, but they still come together and be able to assess kind of what's going on in their own communities and how they can take action to best serve their communities. So we provide that support within the meetings, and then a lot of the behind the scenes stuff as far as pulling in the data and trying to inform our efforts through the data. And I know Kelsey works very closely with a lot of the co-chairs on a regular basis to be able to just think about some of those different initiatives and activities that are going on within the individual lands. So just an overview of the data presentation. So this is really just a part of what we do. We do a lot of the day-to-day sort of stuff, but we're really excited to be able to do this for the first time and share the data with the specific lands. And then what we do at the end of the year is look at a larger report for Cook County, which is what we prepare for DCFS as well. So we'll be sharing these presentations. They've all been vetted by DCFS representative, and we will be able to put together, compare data to Cook County as a whole, and then even across lands to be able to kind of see some of those differences across different neighborhoods, and communities, which we think will be very interesting in trying to understand some of those differences and where to go. So we're going to just have some definitions. Many of you are more steeped in some of the language that DCFS uses and maybe some of that child maltreatment kind of language, but I just wanted to cover a few of those definitions. We'll talk about what the census data or the demographics look like for your particular in Land 53. Then we'll talk about some of the investigation and indicated child maltreatment reports. We'll talk about number of kids and some of the demographic makeup of kids who are currently in placement in the LAN, as well as some permanency data as well. And then we'll have some kind of concluding thoughts, and then I'd love to just kind of turn it over to you all and have a discussion around what does this actually mean and where do we go from here. So many of you, again, this may be familiar to you, and maybe some of you it may not be as familiar, but when we look at these kind of key decision points in child welfare, there's these different kind of points in time where there has to be a decision that's made, and obviously there's going to be some consequences of those different decision points. So when we look at kind of everybody or the general population, and then there's a report of child maltreatment. And as you'll see, when we talk about some of the allegations, there's a number of different allegations that are made, and they come from mandated reporters, non-mandated reporters, folks who are in the community, different sources. And when that call is made to the hotline, it's either investigated for maltreatment or it's not. And DCFS has different criteria for how they make those sort of decisions. There's a specific policy and process for them to be able to do that. We want to go through some of those data that we have. And then some of those cases are after the investigation occurs, they're substantiated or they're indicated, in showing that there are different evidence per se. There's different criteria that they meet in order for those maltreatment reports to be substantiated or indicated. Pretty much mean substantiated and indicated pretty much mean the same thing. They're just used in different contexts. And then at that particular point, a child may be removed from their caregiver or the person who is their home that they're living in, their home of origin, family of origin, or they may not. They may be provided services and still remain in the home. So again, two different kind of trajectories that could occur at that particular moment. And then the child may remain in care, and there's certain time points. We'll talk only about whether the child remained in care or exited care during the time frame that we're looking at. But we, there's different time points that we look at too, if a child is returned home or has permanency within 12 months, 24 months, and 36 months. And we're hoping later on we'll be able to get those data to be able to see how long children are staying in care as well. And then when they exit care, there we'll talk about some of those different permanency options. So how do they exit care? Do they go home to their family of origin? Do they enter into a guardianship? Are they adopted? Kind of what happens at that particular point in time. Okay, so this is just kind of an overview. This, may not be a surprise to many of you who are living in the community or serving in the community. The makeup of the population is primarily African-American individuals, making up about 61% of the population, whereas about almost 28% are white folks who are living in the community. Just move my screen around here. Okay, so here are the reporter types. So this looks at total reports, which you'll see in blue. And the portion that is red are the numbers, so total numbers that are indicated. So it gives you an idea of the number of reports, the sources of where these reports are coming from, and the number of, or the proportion that are indicated. So as you can see, we have 3 that are fairly high. These are coming from law enforcement, which is not surprising given a lot of situations where law enforcement is involved. There may be a child on the scene and they may be in a situation where there's some kind of danger, whether that is direct impact on them or something that is affecting their caregivers that may place them at risk in that particular moment. Medical folks, again, not very surprising when we think about these could be hospital settings, but they could be outpatient, doctor's office, clinics, those types of things where a child is receiving care, or there may be something that is observed that is of concern that requires a report. And then another one is our family, which is very high as well. So these are reports who are coming from different family members. It could be immediate, it could be extended family who are making a report. And you can see too that there are some differences in the proportion that are indicated. So the cases that are most indicated are those who are reported by law enforcement, 55%, just over half. And about 40% of the reports made by medical personnel or folks in medical settings is about 40%, whereas family members, it's closer to about 27% of those cases or reports, excuse me, are indicated. Some of the smaller proportions are folks coming from reports coming from court personnel, DCFS employees, and schools. And keep in mind that the time frame that we're looking at here is fiscal year 21, which would have started July 1st of 2020 and went through June 30th of 2021. So, you know, in kind of non-pandemic years, pre-pandemic years, we would maybe see some of the reports being a little bit higher coming from school settings, but many kids were not in care. They weren't in school settings, and they weren't in school settings consistently during that time period. So that's something to keep in mind too. And what'll be interesting as we are able to look at these data going forward is to see how these numbers may change as well. This is kind of our baseline right now, which isn't ideal to take data and start during a pandemic or as we're getting towards the end, hopefully. But it'll be interesting for us to be able to compare some of those numbers going forward as well. Feel free, and if there's any questions, you know, feel free to ask those questions as we go along. And Kelsey, if you could just take a look at the chat if anybody drops questions in there, just to make sure that I'm staying on top of that too. Thank you. Okay, these are the top allegations. So there are, as many of you know, a number of different allegation types and categories that DCFS has that they use. These are just kind of the top report allegations that we saw during this time frame. So as you can see, overwhelming majority, well, I shouldn't say majority, actually, about 50% of the reports were substantial risk or injurious environment. This tends to be kind of when we think about environments that present a risk to children. So these could involve situations where there's substance abuse, domestic violence, where maybe the child is not the direct victim, but they're placed in an environment where they may be at risk. Second is substantial risk where there's an injury or injurious environment. So there may be, this was thinking more about the risk for physical abuse or that physical abuse may have occurred. And then we also have cuts, bruises, welts, abrasions, oral injuries. So this is where there's situations where there is evidence of physical abuse. I'll just leave that there to give you all just a second to look at the graph too. I know it's a lot to kind of dig in.
I really appreciate, I've not seen this done like this. And thank you so much, Dr. Geiger. This really is eye-opening as we look into the child welfare system in and of itself and look at how the allegations line up to the number of calls and what those calls indicate as the reason why they were being called, why a case has come in. So it not only, it gives us knowledge base, but it also gives us evidentiary kinds of information of now looking into how this system actually works and why some of these cases are coming in the way in which they are coming in. I think this is spot on. Thank you.
Yeah. No, thank you, Paul. I think it's a good point to think about. It gives us information, which is really important, but the context piece is what's going to come from the community members, right? Like you all are going to tell me, you know, what does this actually mean? Why is this number so high in this particular category? And just thinking about kind of what's going on in the world. So if you can see too, the inadequate supervision, home alone, left outside, some of that may be coinciding with what's going on with the pandemic and, you know, children may be at home or folks having to go into work, those kinds of things to try to understand what the context is that we can better understand and provide better support.
Dr. Geiger, can I give you
Yes,
some anecdote? How you doing?
Please.
Some anecdotal
Ron.
information. How you doing?
Yes.
It was interesting when you quoted a couple. First off, you were mentioning the populations, and you didn't mention the Hispanic population.
Mm-hmm.
And basically, what you basically saying, only 10 from what your numbers are, only 10% of the population is in this area is Hispanic. Because you would say like 61% were African American, and I think you said 28% were white. I think that's the number you gave.
I think so.
Okay, that's the first thing. The second thing is I think that one of the things that, now you can't do this now, but you might want to look at it in the future, is what happened in the past. And the reason why I'm saying that, because when you mention the schools being so low in reports, at one time the schools were almost number one in reporting youth. And I think one of the reasons why that number had went down some, because we made a concerted effort to do training, child abuse training with the school staff about what the reports, what kind of reports they should make. And I think that might have had some effect on the amount of youth being reported from the schools.
Yeah. No, I think
And
you're
I think
absolutely right.
I'm sorry. Go ahead.
No, go ahead. Yeah.
I'm sorry. Go ahead. I'm just listening. I'm listening.
I think it's an excellent point, and when people think about reports and they think about number of reports, they see that as being a bad thing. But when we think about reports going down, it's good and bad. It's really understanding the context, like you said, Ron. So it's just because we're not getting as many from schools doesn't necessarily mean that it's happening less, or it just means that we're maybe doing a better job of training about when to make calls and not make calls, and when to provide services, those kinds of things in different environments. So I think it's just really understanding the context of what that actually means. And maybe we do need to have more reports from different settings. We look at childcare settings. Many childcare facilities were closed during this time, or they had limited children or limited availability. And that number is so low. It doesn't mean that those folks are not making reports. It just is a function of kind of what's going on in that moment. But maybe they also need, these different settings need better training around when to make reports to DCFS.
Absolutely. And then it's also indicative of we looking at other other areas of decision points also that stick out as when the team comes together as to what it is that we need to address. Why is there substantial risk, and in that risk, what are the resources that can help mitigate some of that? So you can definitely look at it from a number of points to talk about how then what would be your next steps in this area. I think this is just real good conversation, good insight, and a good starting point.
And we think about number of reports too. I know there's been some changes too to the hotline, to the ability to connect with somebody on the other end. So a lot of that has changed over the last couple of years too. And so the number of reports may go up, but that might just be that they're better at answering the calls and responding, quicker, I suppose. And so maybe that has an effect on it as well. So there's a lot of different things that may go into this in helping us kind of understand what this actually means.
Hey, Dr. Geiger, this is Suzette. And I was just thinking like this last fiscal year, schools were not in person. So teachers or social workers didn't have in-person information to make those reports. So that would be another reason. Yeah.
Yep. No, you're absolutely
that's a great point.
Yeah. So, thinking about how these sort of things change, right? And how policies and how just kind of the times create differences in these. Maybe that's why law enforcement went up, or maybe, that's, again, it's just a function of what's going on in our communities, and that helps us understand those. So next year we might see a rise in those numbers and lower numbers coming from family members. I don't know, but it's important for us to kind of take a look at that and make sense of it. Okay, so here we have it broken up by race. So this gives you an idea of, sorry, I'm just trying to move this around so I can actually see the slide here. Okay, so the majority of cases, as you can see, are involving African-American children in comparison to white children or children who are identified as has Hispanic ethnicity. So this is broken up by total reports, which is our red column, followed by the number of indicated reports with the darker blue column, and then a lighter blue are pending cases. So there hasn't been a decision whether a case is indicated or founded at that particular point. And then the number in yellow indicates the number of unfounded cases. And then it's a little blurry to see here. I don't know how that happened, but of that you can see the numbers here, the percentages of numbers, which might give you a little bit more context as well. Right. Sorry. Okay, so this just kind of gives you a summary to kind of pull it all together, the percentage of total reports by race, and then it shows also the number of, the percentage of indicated reports by race. So there are 76% of the reports were involving African-American children, and 76% of those reports were indicated. Actually, when you think about the makeup, demographic makeup of the land, that actually matches fairly closely without doing any kind of fancy statistics with it. Okay, this gives you some data by gender and by age. So this is always interesting too, to be able to give us an idea of the cases involving, different age groups of children. So we know there's different risks involved at these different age groups as well. The gender makeup is almost equal between male and female. And then looking at the age groups, it's also pretty equally distributed with about 16% involving young children between the ages of 0 and 2. Typically, we see that between 0 and 5 really is kind of usually a much larger column when compared to maybe school age kids or early adolescents. There's also actually the biggest proportion is that 14 to 17 group, which I think is really interesting too. And that helps us kind of think about where we should be targeting some of our services and supports, right? So what might be going on with that age group versus young children, right? Which could be something that we can talk about as well. What do you all make of that? Think about almost 19% of the reports involving children between 14 and 17.
Dr. Geiger, one of the things that I looked at was a couple of slides back when we were looking at the, dangerous environment, and then coming here, out here, we have a huge dropout rate, right? And of course, as Suzette brought up, we were in a pandemic where a lot of these teenagers were left at home. So you do see a lot of homes that are being run by teenagers during the day, and a lot of parties and marijuana use and other things. So I think that could probably be part of what we're looking at for that age. I know I've had a few calls where people they wanted to call in because that was exactly the situation. So I think that's interesting. The other thing that I think is interesting, and like Ron said, we probably won't delve and get answers today, but I also thought it was interesting the number of reports for African-American children that went unfounded, and then you come here and you start to see sort of this escalation in age where it makes me wonder, those reports that were unfounded, were those children provided other resources and services,
Right.
or did this neglect sort of escalate over time? Yeah.
It could be very well be a combination of both. Usually, sometimes when a case is unfounded, that doesn't mean that there was not enough evidence to reach the level for which it would be founded. So just if you could think about it in those terms. So not that it could have potentially been a case where it's indicated, but again, we didn't have enough evidence to put an allegation that would match the, or what do they call it? The court term, if it's forgive me because it escapes me, but it's preponderance of the evidence. That's what it is, that we have to match in order for it to attach an allegation.
And Paula, if you could just introduce yourself and tell everybody what you do.
Hi, I'm Paula Trudeau-Lohana, and I am the statewide administrator for the Permanency Enhancement Project with DCFS.
Thank you, Paula. And I think,
You are more than
not to take away from the conversation at hand, but I think, Paula, we need to bring you back so you can help us community people translate some of this DCFS language.
That will be my pleasure.
Yes. Thank you.
Yeah. Yeah, I think it's helpful because it tells us kind of like what happens after, right? So what is the process here? And there's different policies, there's different procedures and things that we have to follow, and DCFS follows that may seem, complex to many of us who aren't necessarily working in that field on a regular basis. But I think,
Absolutely.
Paula, you bring up some good points about this age group and kind of what's been going on in the last year with the pandemic and youth being out of school, finding different ways and maybe getting picked up or maybe getting in trouble, or maybe, when we think about DCFS involvement, that doesn't always mean abuse and neglect, right? It could be neglect in terms of a lack of supervision or truancy, or there might be some other stuff where behaviorally their parents aren't able to manage effectively. So there's a lot of different reasons that we can take into account when we think about this particular age group as well, which we'll see too when we get to the slide around the age placement broken up by age group too. Fewer of these youth are actually entering care. So the reports may involve this age group, but they may not be entering care at the same rate that some of the younger children are, for obvious reasons. Their vulnerability, their ability to care for themselves, those kinds of things. Doesn't mean we shouldn't pay attention to it. I think it just provides some more context about how we should be thinking about some of these data as well.
And Dr. Geiger, there's a question in the chat. How do these results by age match the total population? So
that's a good question. I'd have to look up the breakdown. Maybe that's something that we can do too, Kelsey, is think about do these actually match up to what the makeup of the demographics are for the land. I don't know off the top of my head, but that's a really good question. We'll find out. There we go. We'll do our best to find out. Okay. So next we're looking at case openings, and here we have it broken down by the child's age as well as the child's race. So as you can see, as I mentioned earlier, about 38% of the case openings involve children between that age of 0 to 2. Again, not surprising when we think about vulnerability, right? And this would actually match pretty closely with what we would see nationally. I'd have to take a closer look at Cook County and see if that's something that matches there, but my guess is it's probably going to match Cook County as well, and even across Illinois. When we look at case openings by child's race, 83% of the cases involve children who are African American, which when we look at the demographics, again, it's fairly proportional, so that isn't really surprising to me. And then we look at some of these different age groups. Actually, the 14 to 17 is higher than I would have thought it would be, but there could be some different reasons for that as well. Here, just looking at it in a different way, where we compare the racial groups across in one graph. So it's the same information that we had before. It just gives you an idea of the breakdowns here. These are the placement types. So when kids do enter care, these are the different types of placements that they are placed within. So overwhelmingly, a home-like environment or placement, about 82% of kids are placed in, which is good. This is good news that we're placing children with either licensed foster care or licensed foster families, or with kinship caregivers, so family or relatives as well. So this is actually good numbers in terms of when we think about the placement type. Much fewer are placed in residential care, are placed in institutional settings. And then we think about kids who are considered independent, which it's a little bit higher, but that's mostly because when we looked at the age group, this is where we would consider some of those older youth.
Hey, Dr. Geiger, one question. What's the difference between residential and institution? What's the difference there?
I'll let Paula answer that question if she doesn't mind.
Oh, okay, because I mean, I understand residential, and to me, if it's residential, it's institution, but I don't know, Paula, I don't know. Help a sister out here.
Well, actually, it's a resident. Well, we kind of commingle those terms together because the institution can be actually a hospital-like setting, and then a residential is a treatment facility. So, you know, in line with Family First, we are definitely getting away from, so we can distinguish the terms. So one would be a qualified residential treatment facility as opposed to an institution that we would actually formulate as a hospital type setting.
Right, that
I
they're
hope that
waiting.
answered your question.
Okay, yeah, that they're waiting on a residential or home-like setting. So it's not permanent. Okay, I'm just a little bit confused because being in the hospital is not a placement. So
No, it is
That's right.
not.
all right,
That is correct. And yes,
Right.
that is the other part of that is correct, that they are waiting on, well, if they're in a hospital setting, more than likely they are waiting for a residential treatment. They need some
Right.
type of that immediate intervention. So
Right.
they're looking to do the treatment component of it in a short time basis to get them ready for the home-like setting.
right. Okay, yeah, cool, got that. All right, thank you.
Paula, wouldn't a group home be considered residential?
No, group homes are group homes.
Okay, well, there's no category in here for group home. That's my point.
Absolutely.
So
And then that's how.
they may be lumping them together. That's kind of what I was trying to.
And
One
it
of
very
those
well could-
categories is group home, right?
I'm sorry, say that again.
I was asking Dr. Geiger, is one of those categories considered, lumped into a group home?
I have to look at how Chapin Hall organized them. Kelsey, do you mind looking really quick if you have a chance?
Yeah, I can look. And what I'll just say quickly is they don't, if there's no data, they don't say 0. So if there's no kids in group homes, they wouldn't tell us that it's 0
Wouldn't
kids.
report that way. Okay.
Yeah, but I can look really quickly to see for other lands if
Yeah.
they have it organized that way.
See if in
And
the
then
description.
more than likely the group homes and residential are lumped together, but we know totally that
Yeah.
they're
Right,
treatment.
Yeah. I agree with Paula. Yeah, they're probably lumped together.
That's my guess too. That would be, I mean, looking at this, my guess would be that they would be in there, but it's really going to depend on how they categorize those. It'd be nice too if they had the home-like broken down so that we had an idea of kids who were placed with licensed foster families versus those ship settings too. So I think that, will give us some more information about where the kids are placed.
Well, in a sense, yes and no, but because we have so many hybrid types of home-like settings, we could kind of run into a parallel of multiple variances. So I can see why they would kind of just keep it in the home, because you could think of an emergency foster home, which would not be a permanent placement. Then you talk about adolescent, then you talk about spec, then you talk about resident. So, then we go down a rabbit trail. So
Yeah.
I can see why they just.
Yeah, I see what you're saying. I guess like for me, it's interesting, community wise and culturally sometimes to think about when folks or children are placed with family members or relatives versus not, so if there was a way to just divide those two up, I think that would just give us a little bit more information. Are we doing well at placing kids with relatives, or are we, or do we need to work on that a little bit more? I see your point though. There's a lot, and trying to categorize those into something that's manageable can be challenging. All right. Okay, so these are the permanency goals for children who are in care. And again, this is kind of a snapshot of all the kids who are in care during that time frame that we're looking at and what their permanency goals were. So about 30.5% had a goal of reunification. and about 20% had a goal of adoption. Usually we see reunification at closer to anywhere between 40 and 50% is kind of like our, national kind of standard when we look at that. And then even just thinking about some of the other lands that we presented to, it's been a little bit higher in that reunification setting, or reunification category, excuse me. About 7.6% had a goal of guardianship. Unfortunately, there's a pretty high number of missing data, and I don't know what that's all about, or what that means, but it's significantly higher than some of the other groups that we've looked at as well. Independence also as a goal, so that's kind of what we're thinking about. Those older youth is fairly high too. Permanency outcomes. So again, this is what were the permanency outcomes for this time frame that we looked at. And the kids who did achieve permanency, these are the different permanency outcomes that they had. So about almost 47% were reunified with their family of origin or their caregivers. About 34% were adopted, and almost 19% entered into a guardianship during this time frame. So of all the kids who had achieved some type of permanency, these are the outcomes that they had. So I'm trying to think of, well, I think the next slide gives us some of those numbers, but let's see, about 40, 45. So about somewhere in the 90s, 90, 95, 96, Kelsey, maybe. Total children achieved some type of permanency, legal permanency during this time frame.
So I have a quick question.
Yeah.
Do we have any particular goals around these numbers? I know we want to increase permanency, but are there any sort of incremental goals, 2%, 1%, 0.006%, anything like that?
Yeah. I mean, ideally, we would have, when it's a good situation, we would have 100% of kids go back home with their families, right? I mean, that's really what we always strive towards. When kids come into care, right, Paula, your case plan is always to go back with your family, unless some sort of really extenuous circumstances. We want kids to go back with their family, but we also recognize that there's going to be situations where that can't happen. So we want kids to enter into an arrangement where there's a permanent outcome, where they are adopted or they enter into a guardianship, which is not as ideal, but it's still a situation where it is a permanent, technically a permanent situation where they're with a caregiver, where DCFS isn't involved anymore.
So kind of a follow-up question, and thinking about the data that we do have available, whether it's data that you can show and share with us publicly, or data that you guys may have, confidential access to. Is there, like, if you were to break it down and look at, for example, the types of situations that may lead to adoption as a more suitable resolution or outcome, are there any ways that we can kind of look at kind of breaking it down from that way? So for example, and this is really not based on what you just showed me, I'm just trying to make a picture example. So if we were to look at this and say, well, a percentage of children, for example, who have become victims of sexual assault, and maybe there are some other things that are going on, and maybe just looking at that on paper, return to home might not be your first, knee-jerk reaction. Is there any way that we can kind of look at those, how that may play out? And the way I'm thinking about it is we, from the community's perspective, looking at things that we can support to strengthen families, whether that's strengthening families or strengthening, the ability to get more families to be open to adoption, for example. Kind of looking at, ways that we can allocate our resources.
Yeah. It's hard to say. I mean, it's easy for us to speak generally about some of this, mostly because it's such a case by case basis, right? And like, just because we have that goal of family reunification, the overwhelming majority of the time at the beginning of a case, it really depends on how the case progresses. And then once the decision has been made to go one way or another, if that case plan goal changes at any point in time, and we kind of have to like refocus on what else is happening. So if it is adoption, I can tell you there's always going to be a need for, well, especially now for more foster homes, more families who can take in kids temporarily, but then also on a full-time basis, long-term. So that I think there's always a need for that. Sometimes what's helpful, Kimberly, is like looking at some of the national statistics too. So I think a lot of this is actually in line with what we would see nationally. So I don't think that we're behind the game. We're not doing terribly in permanency outcomes. But we'll look at next, on the next slide, we start looking at kind of the racial breakdown too. And I think that is what helps inform some of what you're talking about, is how can the community respond to some of these outcomes as well.
Dr. Geiger, can I make a point?
Yeah, Ron, go ahead.
I want to try to follow up with Kim's point, is that I'm interpreting that as saying that whatever the opening allegation is, right?
Mm-hmm.
So we'll follow that out to its fruition to permanency. So if it's an open allegation of sex abuse, for instance, what's the percentage of those youth going back? I'm just making a point now. Or those youth going back home. I know sometimes that's not possible, but I'm just saying, if that's an open allegation, right? And our statistics show that so many of those children go back home.
Right.
So maybe the community can work towards, working with a family in that respect in terms of their specific need, resource need to go back home. I mean, that's the way I'm interpreting what Kim was asking.
Yeah.
Or take it to the next level. You know what I'm saying?
And to piggyback off all three of those points, my take on this is that before they even get to here, let's look at and talk about we talk about reunification. I'm talking about prevention. Mm-hmm. So if we can begin to focus on preventing them from even coming in, because we know that this population, this statistics is talking about guardianship, reunification, and adoption, then somewhere along the line that we kind of should be able on the front end to put those resources so that these numbers can then come down. So I guess I look at it from the perspective of how then we can channel those resources to keep those families intact already and not destabilize them any further than we already have, and then reduce what we have by then putting other resources to get them adopted and get them reunified, because then they're working in tandem. If we keep getting them on the front end, we're reunifying in the middle point, that number is coming down, and then we're strengthening the community with the resources that we have identified that's going to help these families stay in there. I think we're cooking with Crisco, and that's an old terminology.
Yeah.
So that way, then we're looking to, to really bring that wrap around process together of how then we can strengthen these communities, again, one community at a time, because we caught it. We caught it from the front end. And I can guarantee you, if we catch it on the front end with one, there are 3 or 4 other ones we can catch and loop in together. And then it's spreading open wide that we are actually on fire of catching, because there was a need out there that we have met.
Yeah, and
I just looked at it from a different perspective.
I definitely think we're both on the same train, headed in the right direction, Paula, because I think that absolutely prevention is going to be key. But I think when you look at the reality of the community, we have adopted parents, right, who play a really major role in this, and they're going to need support. One of the biggest issues that we hear from parents who are foster parents is accessing service. A lot of these kids are coming into the system with trauma, below grade average. They're already, coming into a new environment. And so the community needs to be able to support those children, but we also really need to prepare those foster families to be able to play a more prominent role in being part of the solution. They're going to be the ones, if that kid has, some sort of visitation rights with that family, right? How are we preparing that foster parent to help manage that? How are we preparing that foster parent not only to be single, solely dependent on DCFS for services, but to also be part of the community in accessing services and maybe being involved in identifying services that are needed. And I think also in terms of reunification, we know that there are some processes and steps that the parents have to go through, so from our perspective and not being under the umbrella of DCFS system, we have to look at it from a comprehensive angle, because we got to prevent what we can, but we also have to lessen the harm where we can, I think, and I think, to Rob's point, knowing kind of how to manage these things so that they are in tandem and that services can be organized on a continuum, So this is definitely, we're gonna have a good time with this, I can tell. We'll have to do Panera again.
No, I think, to your point, Kimberly, I think thinking about, like, that's why it's so important for us to look at what those allegations are, because that is a means for us to be able to step in and be able to prevent kids from coming into care. So there's all these, that's why the decision points too are important to look at. So, I mean, I'll be one of the first people to tell you that prevention is a key component of permanency. When people think about permanency, they think, okay, care, how do we make sure that they enter into these permanent legal situations, when really there's other things we have to think about, relational permanency, those sort of things. But going back and thinking about how prevention can be a key component to permanency too, because it really just means to have kids in a placement where they have those connections, right? That they have that stability. So if that means keeping families together, then let's focus on that, right? So all these different kind of data points that we're looking at here help us inform that. So of course, there's going to be kids who are going to come into care. How do we make sure that those kids don't stay in care long and that they enter into these placements that are permanent and they don't come back into care? So that's important to your point, Kimberly, about the services being able to make sure that, whether it's a foster family or whether it's a relative who's caring for the children, making sure that they're connected to community services, to services offered by DCFS, to make sure that those are long-term placements. And that's not a data point we look at here, but it would be interesting to see how many kids are coming back into care, which is always a difficult, thing.
I think that's a good point too, Dr. Geiger, because I think one of the things that I think would bear a little bit more delving into is that, our kids coming back into care, because we see numbers really jump at 3 to 5, and then they sort of level off. Then they jump again at 14 to 17. And so just, not trying to develop a psychological profile or anything, but, that is an age where children begin to exercise a little bit more independence, where you probably are going to naturally see a lot of back and forth between children and their parents. But I'm also wondering if these are the same parents who were, indicated or reported on when these children were smaller, and now that the children are older. And, and I'm also looking at some of the correlation between some of the indicators, which are, the environmental things, children being left at home or children being left outside or locked out, and kind of thinking, is that happening in that age category? Was this also something that was happening when they were younger? But kind of seeing, and I think even, from the perspective of looking at the number of cases, especially for African Americans that are indicated but not found, that concerns me. It concerns me from the perspective of, are we looking at the care that African American children should have from a different lens? And not to say that all children should go into care. That's definitely not the role, but I think in terms of being able to advocate for services that we need in the community, this is a huge challenge. If there aren't any resources or any youth activities, or then there's really, the parents have limited resources besides leaving the kids at home. If childcare is costs more than what you're going to earn, then, you kind of have these sort of things that, are potentially things that we could, kind of wrap the community around, So This is good. This is good. I'm trying to pour back to you.
Well, if I just wanted to comment on what you were saying, because that's what we're beginning to look at as we look at disproportionality and disparity amongst African Americans in the data that we are presenting across the state wide. Not only that, we're looking at when we talk about decision points and decision making, you know, how our own implicit or our explicit biases or institutional biases and systemic issues that address and how the court systems play a part in how kids come in, or even how investigators are investigating. So all of that does play a part in it in terms of how we are looking at how our children are coming in. And so there's a point at some point in time, because I do work with Dejanay, who's my deputy, is the racial equity component of it. When we're talking about, you know, possibly looking at a blind removal, would that be an issue? So, you know, it's a lot of information that is out there that we are taking into consideration when we look at, you know, institutional and systemic ideologies that keep our families in care longer. How then are we looking at it from an investigative standpoint? How are we looking at it from a permanency perspective? You know, does our policies match up? Are we being culturally sensitive or insensitive? So we are looking at some of all of those, not some, but all of those dynamics to see exactly, even from the hiring perspective, as to where we are from a child welfare agency globally, to say, how are we, what kind of lens are we looking through as we have interactions with our families? So that's a very interesting point.
Yeah.
Thank you, Paula.
And can I mention, you know, this group is talked about prevention. You have to remember that the department has a big influx of intact family cases. Not all of our cases that we deal with are the children in care.
That's right.
And going back to the prevention piece, that's where this group could really come in handy, because to prevent those intact family cases from becoming cases where the children are in care, they could play a big role in that. Now, I know none of your data really is around the cases that don't come in, but we do have a lot of cases that we work with that never come in. They do need services.
You know, I want to comment on that, because I think that's an excellent point about how DCFS should operate in this environment, because intact families, what they do from the start is assess the resource needs of the family. That's what intact does. I don't think the follow-up people do that, because they have so much other stuff they had to do prior to when the case opens. But I don't see them actually, you know, working with the family from the start. I'm talking about the child that goes into care. What is this child's resource needs when they go into the foster home? Not after in the foster home, before they go into the foster home. That way it would enhance the child, you know, eventually be either going back home or going to some permanent placement, because it's, you know, you do that assessment from the start. You don't wait till after the child's in care trying to figure out what kind of resources that child needs. You could do that before the child's even placed. And that's what Intact does. That's how they try to, you know, deflect kids out of the system.
So if I could just give a little history of background that, since I came from the placement, to kind of shed some light on that, that's exactly what does happen. Every aspect of a point that the case comes in, from the call to the investigation to the intact family, then to the permanency team, through the system, the case is being assessed and reassessed for services and needs to the family. We can't move through this system without an assessment. There is a clinical assessment that is done at given points. There is a point where you have another assessment to talk about services, even through the court system. So our families are let me put it this, I don't want to say well assessed. I think our families are assessed, and I think they are over assessed. to the point that we are not getting to the assessment of the need, if I may put it that way. Because we do assessments, but how effective are those assessments at the onset that would then alleviate that lag time for those families to go in? Because even at the point that a case comes in and a child is moved multiple times, if a child is moved out of a placement at the fifth move, there is an assessment to say what happened then, where's it go? Because now we're progressing. And I don't want to get into the weeds of DCFS, but I want to provide some knowledge base of how the system actually runs in order for us to get, and sometimes how we get to these types of situations, because we are assessing. But cases, our families now have multiple trauma and complex as it is, and have multiple needs that we now have to build specific services for the needs. We have so many youth that come in from dependency. We talked about some of those cases where they come in that they may be not have a mental health situation, but there are other issues that impact service needs that the families are unable to do. So you have all these variations and all these needs of the families, that this system is very complex. And so we have, and then the families come in what they originally come in for. We find out that there are other needs. So there's always an assessment piece that is going forward, but is how then do we take a mix to get that families back on the right track so that we can get them either through the system or prevent them from coming again. And it lies in how best that we, and when I say we have to pull the community in, we have to pull the family in, we have to pull everyone in to assist this family and what their needs are, because they assess what they need, and 9 times out of 10 they already telling us what they need. But we are so busy assessing and trying to get our assessments in that we are not really hitting where we need to be.
I think just listening to you, Paula. Oh, you went on mute.
Can you hear me?
You just got back. But,
Okay.
Wanted to just say, like, listening to you, I'm wondering, and I don't know if I'm jumping ahead in this particular presentation, but I think it would be very interesting if we would be able to look at some of the barriers to accessing services. Child welfare, DCFS is, there's a stigma associated to that. It creates a lot of conflict. Parents don't appreciate being called into DCFS. They don't appreciate the intrusion into the life. And then you have the stigma that kids have being in foster care, the trauma of being separated from your home, and I think, that is a reality, that stigma is a true barrier, which I think really explains the need. And I'll pick up on what James said about having community-based resources, to provide some spaces that people aren't always subject to these clinical or institutional level interventions. And I think what we're looking for between, on behalf of the land, is to better really understand how we can leverage the small amount of resources that we have with this huge pot of resources that DCFS has, that a lot of times the community is not aware of, so we don't have access to. If we can play a role in, building a bridge, but also using this relationship to leverage so that we can also have those resources to prevent children in care. But also, I think when you look at prevention, you have to look at it from a comprehensive perspective. It's not only about creating more programs, It's about having the community at the table for all aspects of prevention. And that includes policy, that includes funding, that includes collaborating on initiatives and program design. And so I think, this is really, I'm very grateful that we're able to have you guys here and to have this conversation and actually have some data to start to shape this conversation. With a lot of the things that we're doing around mental health, that stigma piece, I think, is really specifically one of those areas that may even be found to drive a lot of the disproportionality, because if people don't feel that these services are culturally relevant, it's not just about them being clinically appropriate. It's like you can't feed the spiritual until you feed the natural. So if people are not open to services that are generated from a DCFS or some sort of, institutional thing, then I think this, hopefully this will lead to more conversations about how DCFS can support a larger variety of grassroots or smaller organizations that just, may not have all that institutional knowledge or have the same language as DCFS. So I'm hoping that one of the things that will start to happen from here is that we start to align the language. This is, I think, a conversation that I definitely enjoy being able to tell you the community perspective, and then you tell me the DCFS perspective, because then I can write notes about where we're saying the same things, but just using different language.
Yeah, I think that's a great point. I think, it's the prevention and supporting families isn't only the job of DCFS, right? It's the job of all of us as community members, as professionals, as a community. That's our job, is to be able to support each other, right? But there are some means where we can work together and kind of use what resources we have and what expertise we have to be able to strengthen those connections and networks to be able to support families too. So I appreciate that. Okay, so these and all of this information, we're going to pull this together and be able to share it with you all. So I don't think it means that our discussion has to stop here. I think that this is an opportunity for us to continue our discussion as well. So just keep that in mind too as we go forward here. 1 second. Okay, so this is just an overview of some of those numbers that we were looking at earlier. The total number of reports, there was 4,179 reports. About 1,400 or just 1,457 were indicated reports. So it's about 35% of the reports were indicated. During this time frame, there were 688 children in placement. There's 128 cases that were opened, and 96 children achieved permanency during this time frame. I'll give you a snapshot of some of those numbers we looked at. So just some conclusions, which we discussed throughout the presentation as well, that the reporter type with the highest numbers were law enforcement, family, and medical reporters. The age group that had the highest percentage of child placements were between that age group of 14 and 17. The age group that had the highest percentage of case openings, however, was that 0 to 2 years age group. And the vast majority of placements, about 82%, were in a home environment. All right, just the contact information there, which you all should have. Stop there. And then just see if there's, I know we've had some discussion as we've gone along, but just wondering if there's any questions for me or for the group, or just any comments, questions that folks might have.
So Dr. Geiger, your last slide said case opening. So are those just children case openings? And I know I don't want to get into the weeds with DCFS because family case
Who knows where that will lead us, right, John?
Case openings mean a different thing, mean different things to us. So are your numbers just children case openings?
I believe so, yes. I'll double check that, but I'm fairly certain that's what it is.
When it's given to us, it's labeled child case openings.
Okay.
Okay, that's helpful.
I just wanted to just jump in and say, this was really helpful. I really appreciate you, Dr. Geiger and Kelsey, for putting this together. I think this is, really what I know I have been kind of asking for, because this is something that we can kind of sink our teeth in, so this was really helpful. And I really appreciate Paul, Ron, and James, you guys, also your insights as well.
Yeah, thank you. And I think what we've noticed too in doing these presentations is sometimes it takes a little bit of time for some of this to sink in and just digest it. And we're walking around the house or walking outside and just kind of think about some of these things. And so I think it'll be important to take that, maybe refer back to the presentation and in the time that we have, and then we'd be happy to come back and join you all again and continue the discussion, or even just think about some different strategies in terms of like, what does this mean and how can we use it in a way that's helpful to folks in the community.
Dr. Geiger, this is April Tolbert. I'm with the Cook County Department of Public Health, a great presentation. In terms of coming back, as you were presenting the data, I have a background. I used to work for the department years and years ago in my previous life. I was just thinking about, from the public health perspective, and Kim sort of alluded to this, like I'm thinking about like all the policy systems and environment that contribute to families being unstable, community instability, and things like that. Looking at the data, is there a way, like, do you all have data to show the successes and how those families were success, what stabilized communities, and how we can look at that more to say how can we use more of that data to counter this data, especially as we're in COVID, still kind of coming out. That's what I was like thinking about. Okay, this is amazing. How can we combat some of this? I'm thinking from public health on the prevention side.
Yeah. I appreciate that perspective, April. I think it's always helpful for us to be able to think about like, what were those cases that were success cases, or where families were unified, or were provided the services that they need. What was it about those cases or those circumstances that made them successful, so that maybe we can do a little bit more of that. Now, that doesn't always mean it works for everybody, because there's going to be cases where we still do all of those things and do everything that we need to do, and it still doesn't work out. And that's just a fact of life, right? But I think you have a good point. And as part of this project, we don't have access to those data, but I think that would be great if we could even just get a snapshot. Give me like 10 success cases and let's really dig into like what worked for them. And we can look at some of the literature, the research that is out there around like successful cases, I think, that would be able to give us a little bit more insight around that. But that's more, it's not as community specific. So it wouldn't be like, oh, well, they were connected to a family advocacy center, or they had a really supportive caseworker that had, X amount of touch points or something like that. Or, they had a really supportive family or something like that. So we can get ideas about what works in child welfare in terms of cases, but sometimes they're not as meaningful when we think about like what the community's needs are, and directly kind of, addressing some of those issues, if that makes sense.
Yeah, no.
These data don't really help us with those questions, but.
I'm wondering, Dr. Geiger and April, that was a really good point too. And kind of going down that rabbit hole, I'm wondering, and this may not be something that you can share with us for confidentiality reasons, but I'm even wondering if we can maybe take a further breakdown, because that number represents 51 different cities, right? So that's an aggregate number of Woodland, Rich, and Thornton townships. I'm wondering even if you might be able to give us some comparison data if we look at maybe one community that maybe has a denser population of children versus one of the communities that have a lower density. And I think One of the things that Kelsey helped us put together was this community needs strength-based assessment. And maybe that can be something that the department can even help us, I'm sorry, that the university can help us with, is maybe coming up with some sort of a tool so that we might even be able to look at these communities. And I think, April, to your point, you know, even without knowing specifically what's going on in each family, from a public health and prevention perspective, there are some key things that we know work, right? We wouldn't be without a guidepost, you know, we can look at things that we know from a best practices standpoint, such as, you know, number of available youth activities, you know, what's going on in the park districts, and, you know, what kind of school system is going. We've also been doing some work around school climate and culture, because that's sort of an intersection for us that kind of helps us look at the school as a snapshot of the community. So, you know, I think, you know, kind of, I know where we are as a land, and, you know, and not to say that this won't change. It's been really hard, especially since, you know, COVID removed the ability for us to really gather and meet and network more organically, just identifying where these folks are, where the resources are. So, you know, anything that will help us to be able to tell the story of strength through data, I think would also inform some of the work around disproportionality, because that's something that's missing. A lot of things that families do that are positive, they don't get as much sunshine as, you know, sort of this theory that we have to hurry up and save people, when, you know, there are a number of strategies that say the people have to kind of be involved in saving themselves as well. So I'm wondering if that might be something that we can maybe look at in terms of coming back to this data, maybe looking at some data that we might want to have access to. And some of it may be archival data. It may be something that we can just look at, you know. So just,
yeah. I'm sorry, Kim, I just wanted to quickly jump in. That's exactly what I was saying. Like, how do we balance this data out? A lot of the work we've been doing at the public health department, we've been trying our best, especially during COVID, to shine a light on what we call our bright spots, like that qualitative data that does not get shared, that storytelling that is just as significant as those data points that we see as those numbers that are actually people. Like, you know, as I was looking at that, I'm like, these are people's lives, these are families, these are generations that have been impacted potentially. So yeah, this is exactly like, how do we balance it out? Because if you look at the data, sometimes it could seem so daunting, like, oh, over 70% of, you know, African-American males, or, you know, whatever, are in the system. Like, okay, we know that that's true. What are some of the some great stories though of folks that have been stabilized, that have connected to resources? Kim, like you were saying, how did these families find out about this resource? How were we able to break down the stigma? How did they get through that? Like, until we really know that, I don't know, that data, it doesn't scare me, but there needs to be, and not for you, Dr. Geiger, I'm saying this from public health too. Like, you know, we have to share, like, there's this and there's that. So how do we have more of those bright spots to share out?
Yes. Oh, I appreciate this so much, April, as somebody so quantitative work is not actually what I do the most of. I do more qualitative work, actually. So to me, and you know, in public health, I mean, there's numbers everywhere, right? We can make the numbers certain ways and look at them in different ways, but until we hear the stories and the context that comes from that, then, you know, it's harder for us we can make assumptions about things all day long about what they actually mean, but to hear those stories from folks and to get people's ideas, their strengths, you know, all of those things, that's what really tells us what's going on. So there's different ways of doing it. I mean, just like you said, we can look at heat maps, we can look at, you know, geographic data, we can look at, you know, quantitative data like we've presented today. There's more sophisticated ways of looking at it that dig a little bit deeper, but I agree with you, is really going out there and finding out from community members what's working, what's not working, what can we do better, who can we involve more in the discussion, you know, those kinds of things is what's really going to start to move the needle forward, I think. So I completely agree with everything that you're saying. I mean, this is just like
And I
one
couldn't
component of
agree-
it.
And I couldn't give more.
Data is really
Mhm.
important, and it'll lead to other questions.
Absolutely.
Other things that we want to
Mhm.
find out more about. So it's not like one is really better than the other. It's really how, like, what are the questions that you want to ask and find out the answers to? And what's the best way to answer those questions?
And there was a question in the chat asking about creating programs or institutions for youth 14 to 17, and at what age should we be pushing independent living?
Yes.
You know, to me, that's a case-by-case situation, because if we talk about a child, we think about the developmental aspect, the emotional aspect of a 14-year-old and 17-year-old. Independently, are they really independent? You have some older that are not independent. So it depends on the youth in and of itself, the support that surrounds that youth, that helps prepare that youth, and the willingness of the youth themselves to be ready to be thrust into independence. I hear all the time, you know, I'm tired of adulting, and these are adults saying, you know, adulting. So I can imagine what a 14-year-old or a 17-year-old would say when they are faced with having to make decisions, you know, important decisions for their lives at that early age. So, you know, again, in my professional opinion, I think that's a case-by-case basis. You would have to look at the emotional readiness of an individual when we're talking about pushing for independence.
But you know what, Paula, and this is kind of the community perspective, right? So when you look at and the reasons that children 14 to 17 are left home, and maybe you correlate that with the number of cases that are open for 0 to 5-year-olds, a lot of these kids are already adulting. They are the primary caregivers for their siblings, for sisters and brothers, which we see a lot of, you see a lot of kids from 6th grade on up that are caring for baby brothers and baby sisters. They're feeding kids. And then when they get a little bit older, as I mentioned, some of that independence, right, that they've had to exercise for 2 or 3 years, maybe because they're left at home or there's no responsible adult, or because economics say that you have to stay here while I'm at work, right? And so when you talk about the reality of what happens to families, right? And to both April's and Dr. Geiger's point, these are families, these are not numbers. And people actually, when I was part of the land and we had the Family Centered Resources project, one of the things that I did was advocacy. I went into the schools, and for a short period, we were on one of those rapid response teams. And I'll just share this story and I'll keep it short, but we went into a home and the mother was, she was disabled. She was unable to get around really well. And she had 3 small kids these kids were like under 8. And she had a teenager. Teenager was about 17, had been out of school for more than 2 years because mom was sick and needed the help at home. Well, the other members on the team wanted to say, well, no, if you don't go to school, then we can't do this. That has to be mandatory. And I said, wait a minute. You're asking this kid who loves his family, who loves his siblings, who has been caring for them, to turn his back when the reason that he's doing this is because we were unable to support that mom. We cut off her support, her transportation, her access to food stamps, right? And so I think that we also have to be very mindful that all of these situations, like April said, is not just the result of people blindly being neglectful. There are some real situations here. And I do think that, this is, I am making your point, Paula, about a case-by-case scenario. But I think that if we do find that scenario is happening, and the reality is that by the time these kids get 14 or 17, and kind of going back to respecting the difference between prevention and intervention, you got kids who are already worldly. You know, if I pull the numbers on substance use, these kids are worldly. They are, you know, having adult relations. They are involved in drug use. So they kind of come out of that wormhole, a lot of them. They may not be emotionally ready, but they definitely, a lot of them have been thrust into an adult situation where I think guiding them is, you know, guiding them and providing some structure. I wouldn't, you know, I think that might be something that we could look at, you know, having something like that.
I guess I'm a little torn because, and I hear what you're saying, but I also hear sometimes some of my youth that have been thrusted into those situations. That's why I say case by case, because I know at certain given points, yes, they are more experienced this generation than some of us, and have been involved in situations that I have not seen until I've gotten to probably some of the ages that I've gone through. But are they emotionally ready is one. Being thrust into a situation doesn't mean that I'm emotionally ready. That means that I'm just stepping up because I have to do so. That's one. Secondly, we have laws that will also prevent them from going to that tipping place. So you have to dance around. You still have to have someone to come along and say, okay, how about if we do it this way? But we also still have to respect the age and the emotions that attach to that. And not only the emotions that attach to that, are, you know, the willingness for them. It is so difficult for a youth that is 14 to 17 years of age to be just that age. Now, okay, so I may be dating myself, but I really would like to see them at some point in time just be 17. And we don't allow, the world does not allow them to do that. So, you know, and I understand that family members may need to do that culturally, spiritually, or whatever. But at some point in time, if you really pull back the layers of the onion, they will tell you themselves, I just really want to know how it is to hang out with my friends and not be responsible for my siblings or my ex or this, that, the other. So that's why I say, you know, we have to walk circumspect individually.
I think that we definitely see the same vision, but I think that there's also reality, you know, and I think that as we kind of continue to come together and look at the difference between the DCFS perspective, right, and the community perspective, you know, I think to your point, you know, for example, one of the things that we do when we do programs for parents, we offer childcare, right? And I've done programs with kids who couldn't attend because they were childcare, you know. And I think the other thing that you have to kind of look at too is that once that kid has been thrust into that fold, you can't force them back into that bubble. That's broken. And so we have a lot of programs and services that operate from just that perspective. You're a child, stay in a child's place, and doesn't take into consideration that, yeah, you may be a kid and look like a kid, but we also know that our children are more frequently, you know, their behaviors are more frequently criminalized, right? Just even from looking at them, they're also perceived as looking older, being mature. So to the point of looking at prevention from a comprehensive perspective, you know, those are some of the things that your community partners can work with, right? Because that's not just the individual interaction between a case manager or a staff member and this kid. It's about creating a set of community conditions that do reinforce this idea that children can be children. But we need things for children to practice being children in. But we also need to be aware that as we're moving towards this sort of utopian community, that we do have a group of kids who we've already identified as 14 to 17 that have been taken out of their home, right? And they are now navigating some territory. And when you talk about the trauma and the reality of this kid actually finding culturally relevant and consistent services, you're talking about a kid who at 14, I want to know how many of those kids are running away from these homes. How many of those kids are running away from these institutions, right? And at that point, we can't say, well, we don't really want them to be independent because we don't think they're ready. We need to get them ready, because that's a reality. You know, we don't keep the numbers because at 18, they age out, right? They age out. So we don't really know what happens after that, right? So all I'm saying is that, yeah, we want to make sure we're preventing it on the front end, but that we are wrapping around some of these families that are going to need a lot more intensive support. And at the same time, making sure that we're contributing to the development of well-balanced communities, right? So I just think, you know, that's a really good, you know, that's a, you know, I would like for us as a land to continue the discussion around that particular point too, you know. And I don't know, I know that DCFS does have some transitional programs and things, but I think that's a place that we may have resources already, right, that are working with youth and young adult that are working around independence. And, you know, and I think that's also something that we had 100 people on the call, and we started talking about the skills that kids need, you know, being able to understand finances, being able to understand responsibility, you know. And I think in terms of when I asked about the earlier numbers, and I said, you know, we're identifying all of these cases coming in, but they're the highest of unfounded. When do we say that, yes, our children need really a lot of services, right? Because I think that also creates this vacuum of resources. We're not calling these things out as things that we need to support. So then we limit the support to these clinical interventions and these institutional interventions, right? So I just want to kind of put that to say, there are going to be some things that DCFS is going to be comfortable with because you guys have that structure. But I hope that we can leave the door open to really hear the voice of the community when they're saying things that they're saying too.
And thank you for that. And so let me just kind of clarify one point. And when you talked about, I wasn't talking about from a DCFS perspective laws. I'm talking about the laws, that jurisdiction that just citizens are governed by in terms of chronological ages. Then you bring in the entity of DCFS. So that's what I'm talking about, because usually if a law is broken or broken, it doesn't come to us first, it comes to whoever the jurisdiction is, and then depending upon the age, then we get involved. But yes, to that end, you know, the department in and of itself, we are to begin to look at doing independent analysis or programming with youth as early as age 8. Are we doing the best job? I probably would say not, because I still see a number of our youth that have reached out, have aged 18 and 19, because we keep them to 21, that really have not benefited from the independent services that we offer. Now, it could be two ways. Either they weren't interested, they felt that they didn't want it at that particular point, or we were not on that trajectory to offer it. I don't know, but it is offered.
And I think one of the things, and I apologize, but I think one of the things from a perspective of program capacity building, right? You know, one of the challenges that I think community people have in working with systems is this. There's sort of this perception that if they don't come, it's because it's their fault. They didn't want it. They weren't interested in the services. They don't want the help. But I think from a community perspective, you may find that the services are not relevant to the need, which is why having these types of conversations is really important, because, you know, one of the resources that we can bring to the table is sort of this, you know, kind of look at the back door of things, right? When April talked about doing qualitative data, really doing some consumer surveys, doing, you know, talking to people. And I think just globally, and not just you all as DCFS, but even other organizations and systems that I've worked with, that's a very common approach, is that we sort of tried these things, they didn't work, so the people didn't want it, which may, you know, definitely if people aren't accessing services, I think that's almost a universal issue, at least across the US. I can't speak for everybody else's, you know, country, but in the US, we do see that as a leading issue, especially when systems are trying to get into that community level, you know. And, you know, maybe as we continue to look at this data, that may be another area that we can start looking at ways that DCFS and this particular land can collaborate. Are you on mute?
Can you hear me? Yeah, yeah. Okay. Yeah. I agree. And what I wanted to continue to say is that, you know, I that was part of, you know, the partnership that I think that the department can have. You know, we do have this, you know, this entity with a spider of resources where the case managers are able to go in on a community level and to really interact with the community for service provisions. And I think we need to do a better job of that. And when I speak, I'm not speaking from a global perspective. I'm speaking from a knowledge-based perspective because I did it all. So when I speak, I'm talking from a lived experience of what I've done within the department. So I know the functionalities of how these systems do work and operate. So I know because of, you know, sometimes we that's why I always say we don't always get it right either. We do need to, I would like to see a more collaborative effort and partnership with communities, because the goal is helping the communities help the families. And that's where your family advocacy come into, and your other partners within the community, so that they can wholly support that family and the needs in the community with those community services, so that they won't have to come into the department and unless there's an actual need for them to enter. And if it's so, then how then we make it short term and then send them right back to the community to get that support that is needed. So I definitely agree with that. Thank you, John.
I see, yes, I'm trying to type back really quickly. Can you have somebody come and give us an overview? So please excuse my spelling if I'm off. I've heard about Spider a couple of times, and I would love to hear more about it. You know, as we are sort of gaining more members to the land, and you know, we're getting more schools involved, more organizations involved. You know, any way to get the resources to the people. And you mentioned, and I apologize if I was trying to ticky type and you might have already said it, but I know that you were saying that it gives a way to engage with families. And so I didn't hear, or if you said whether or not we're able to get any kind of real-time feedback, or even to do any are you able to share any metrics on that?
I'm not able to, and I did reach out last month to Jeremy, who is on standby, and he said he will be more than willing to come out and to do a presentation at one of the meetings. So I think I'm going to leave that to his level of expertise, and I'm just going to step out of that one.
And look, and I said, well, I'm not gonna say anything else because I don't really know about spiders, so I'm turning my mic off at this point. I love when you come to the meeting, Paula. We have some good conversations. I see Suzette, Suzette is gonna be helping with us booking the guest speakers for the land. So I'll jot that note down for you, Suzette. And I know Kelsey's got some contact information because we had talked about getting somebody to talk about spider on here. So
Okay, and April too, we want to have, excuse me, but we want to have April too to talk about the Department of Public Health. Okay,
No
Yeah.
problem. Yep.
I'll be in touch, baby.
Okay.
So I know we normally try to keep it at about an hour and a half, but this is what I mean when people are engaged, right? This is good conversation. It's something that is kind of ticking everybody's fancy because we're able to look at it from different perspectives. We're able to kind of drill down, and this is exactly what I needed. So I know Dr. Geiger had to jump off, but Kelsey, I really appreciate you working with her to put this together because I think that this is a game changer for us as a land. I think that yes, we all know that we need more programs. We all know we need more services, but we're at a day and time where we need to know what we're doing. And we need to know why we're doing it. And we need to know when it's working. And we need to be very open and honest about why it's not working. And I think that, all of these buzzwords, cultural competency, disproportionality, all that boils down to, are we listening to the people? Are we using our data? Are we incorporating the voices and the experiences into these conversations, or are we, just really kind of focusing on what the institutional goals are, which is not a bad thing because we have to have some goals. We have to kind of know what we're working with. But I think this gives us more meat on the bone to kind of figure out where do we go from here. And I am going to definitely say, April, we need you on our assessment work group committee. We have been trying to figure out ways to really organize and really do strategic outreach. We have this meeting once a month, and it really is mostly our community networking meeting. We have a group of steering committee members for land that sort of work around making sure we have guest speakers every month that are relevant. And we do that because we want to give people a space to kind of see each other, to hear what other people are doing. And hopefully if there's some synergy between what you're doing and what this other person is doing, that you guys can connect, we do meet every 2 weeks. Really, we have a meeting every Monday. One meeting is the steering committee meeting, and that's where we really kind of plan the nuts and bolts of some of the things that we do in the community. So fortunately, this land does have some partnerships that contribute a number of resources. So one of the things that we have coming up is on December the 1st, we'll be supporting School District 156 with our SEL program and with some of the Lions that we work with. And we're going to be doing a paint art party. I have to be careful not to say paint and sip because we don't want to give the wrong impression, but everybody knows what a paint and sip is, right? So, we're going to go out. The art teacher's going to do one of those guided painting lessons around mindfulness. We're going to bring in a bilingual speaker to talk with parents about ways that they can communicate with their kids at home. And we're donating gifts for the parents and crafts for the kids to do. Childcare is going to be provided. Then on December the 19th, we're going to do a barbershop pop-up. We're taking this conversation to men and boys in the barbershop. We've got former NBA draft pick Sam Hill is going to be our facilitator to talk to the guys about starting these conversations, as well as we'll feed them and give them some giveaways as well. Dalton Park District is hosting a women's conference about empowering women. It's a good opportunity to send parents out. That's going to be on November the 21st. And so, these are the types of things that's our contribution to events that are both culturally relevant. They're not intimidating, it sets the stage and start inviting people to come out and to have these sort of organic conversations. Later on in maybe in the first half of 2022, we also have some resources to do a SAMHSA project, Substance Abuse Mental Health Services Administration, which is called Community Talk. So we are kind of using some of these opportunities to engage the community around talking with kids and building community capacity for drug prevention, which is a huge prevention framework that really takes into consideration bringing all of the elements of the community together, not just around individual programs, but around changing community norms and, when appropriate, addressing the policies that make it easier for kids to go down a pathway of addiction. And, so I will definitely keep you guys abreast on that. I want to know, do we have any additional questions before we kind of try to get this meeting closed out by noon? And I know that Kelsey usually reads our announcements, and I see Suzette, so I'm going to give it to you, and I'll go on mute.
Okay, well, I just want to say that there was Ken Benson from Land 56, who is with the Robbins Blue Island Neighborhood Network. And he is hooking me up with some people from Metropolitan Family Services in working together with us. And just listening to you, Kim, I was just thinking, it's power. Connections have power. And if we can connect with other communities, whatever they're doing and we're doing to put it together, very powerful. And then also what Kim didn't mention is that we're going to be having good vibe cafes where we talk about community coming out, and we'll have like a yoga person, or we'll have a line dancing person, or we'll have a stepping person. Anyway, just getting people out, having a good time, giving them information, giving them giveaways, feeding them, and talking about issues that they want to talk about. So I just want to put that in there.
Tag team, yeah. Thank you, Suzette. Yes. So we're really excited, and I'm really excited to have a little bit of data, a little bit of meat to dig into, and so I want to personally thank you all for coming. I think this is a really good meeting. It's a really good conversation, and I hope that you guys can continue to join us, because I definitely want to keep talking about this. Thank you. I'll turn it over. Kelsey, do you have any announcements for us today?
Go ahead, April.
Oh, just really quick,
I'm
Kim, I just
sorry.
wanted, oh, no, that's okay, that's okay. I just wanted to bring attention to the chat for all those events. Miss Suzette, if you all think it's appropriate, of course, you know that we've been, maybe some of you all know that the health department have been taking our vaccination efforts on the roll. We've been doing hyper local strategies where we're partnering with community-based organizations literally in the community, making it more accessible. Kim talked about accessibility. So for any of those events, Ms. Suzette, that you all are thinking about, if we need at least 2 to 4 weeks notice, really 3 to 4 weeks notice, that you think would be appropriate, I'm going to put the link in the chat to consider a COVID vaccination event. Some of them it may not be, but some of them it might be. So I just wanted to throw that out there for you all to consider in terms of planning for like December and January.
Yeah, cool beans.
Yes,
Yeah.
thank you.
Hey, April, just a quick question. Do you all still do the healthy cooking demonstrations?
We do not. We haven't actually done those. Well, you know what? So let me say this. We don't. However, our partner UIC Extension,
Corner store, are they still doing corner store initiative, or?
we are not. So our like 90% of our efforts have been COVID, of course, COVID related
Right,
the past
right.
2 years. But I might have someone that I can hook you up with, Dominique Harris out of UIC Extension.
Okay.
They have their agricultural program, and I think they've taken some of their programs online. So I don't know what they're doing in person, but I can share that with you for sure.
Thank you. Thank you.
Yeah,
Thank
you're
you.
welcome. Yeah.
And I can start with the announcements. First, I will put the link to the November 2021 folder and the announcements page in the chat, as well as my contact information. Just to start with some announcements, as Kimberly mentioned, Lions Club International Foundation is accepting applications from schools and community organizations that are interested in receiving free training, technical support, and materials to implement the evidence-based social emotional learning program for children pre-K through 12th grade. There are also additional opportunities specifically for community-based organizations to participate in an upcoming study on delivering SEL programs virtually for youth aged 12 to 14. NAMI South Suburbs recently hosted a Burgers for Blankets event, and where they collected a lot of blankets. And so they're looking for shelters or other institutions that might be in need of blankets. They have some partnerships, but they want to open it up to any other community members or organizations that might know of other opportunities. And if you do have any knowledge of some places, you can contact Marianne Bethos. I've put her email in this announcements page. And then on November 21st, there will be a women's conference called Community Leadership, Sisterhood, Relationships, as well as a holiday pop-up shop. And that will be from 10 a.m. to 4 p.m. and it will be hosted by the Dalton Park District. And then also on November 21st, there will be the Zeta Phi Beta Sorority presents the Holidays in the Pandemic, a virtual discussion about mental health and well-being. And that will be at 3:30 p.m. on Zoom. And Kimberly will actually be a part of that panel. So if you'd like to see her, I've included the meeting information in the announcements page, but there's also a flyer in the November folder with more information. On December 1st, there will be the art party for the Lincoln Elementary School parents. And so Lions Club is accepting donations to supply some self-care items for parents. So if you're interested in that, you can contact Dr. Young or Kimberly. There will be a Lions of Illinois informational session from 12 to 1 on December 4th. And if you're interested in attending that informational session, you can contact Kimberly for a little bit more information. On December 19th, there will be one of these Good Vibes cafes, which will be called Cuts and Combos. It's a barbershop event from 2 to 5 p.m. And its purpose is to stimulate conversations about mental wellness and substance abuse for men and boys. And so the Lions Club is also accepting donations to supply some self-care items for those men and boys as well. And you can contact Kimberly for more information on that as well. That's a statement. If you need more information, contact Kimberly. And finally, there won't be a December Land 53 meeting just due to the holidays. So we will be, our next meeting will be in 2022, but you can always send any announcements to me. I can share them out to the LAN, or you can send them to Kimberly as well. And if you would like to attend the assessment work group or the steering committee meetings, just get in contact with any of us and we will be happy to share the link. And that's all I have. And I finished before 12, so that's good.
Thank you so much, Kelsey. And again, I want to thank everyone for coming out. I want to thank our friends from DCFS, from UIC. We had a couple of Lions guests from both Indiana as well as from Connecticut. And of course, all of our Land 53 team. We will not meet in December. That is really just too close to the holidays. And I know a lot of people are going to be off. We will send out notices for the committee meetings because some of those may fall during that week as well. So please, if you are on a committee, you will receive a notice. If you are considering joining one of the committees, I believe that's in the announcements. We still got the link there. So, definitely. And if anyone needs to set up a sidebar conversation to continue the discussion, definitely please reach out to myself, to Kelsey, or to Suzette, and we are more than happy to make sure that we keep this conversation going. And I am going to bid you all a good night or good afternoon. I will leave the meeting open for a few more minutes because I know for me, I like to scroll through the chats I like to get a few minutes to scroll through the chat so I can pick up any contact information or announcements before the session ends. So thank you guys, and have a wonderful holiday and have a great weekend. And thank you so much for joining us.
Thank you. Have a good holiday, everybody.
Yes.
Hey, Ro, I'll be in touch.
Okay,
Thank you.
sounds good, Suzette.
Okay, all right.
Thank
Bye,
you.
Paula. Bye, Paula.
Bye, Paula.
Bye, Kelsey.
Take care.
Hey, look, there's Ron.
You gotta take your mute off. The mute. You gotta take your mute off.
I'm sorry, it's off. It's off. I've been here. I've just been hiding.
Good seeing you, Ron. I haven't seen you in years.
Yes, ma'am. I see you.
Yeah.
So okay,
good
you
seeing
you know health. I mean, Department of Health now, huh?
Yeah, good seeing you.
Yeah, same here. Same here.
Yeah. Yeah.
You're not retired, right?
No, I didn't know that. Good for you.
Yeah, they finally kicked me out.
Oh, that's a good thing. I mean, you did your time.
Yeah,
Right.
I'm just hanging around. That's all.
All right. It's still connected. That's good.
Yeah, try to stay connected.
Yes, wonderful. Okay, I'm gonna hop off. You guys have a great
right.
holiday.
All
All right, you too.
stay.
All right,
Take
bye.
care. Okay,
Bye-bye.
bye-bye.
You left your certificate. We had
Me?
it framed and everything. I said, okay, I'll see Ron. He got mad because he came out on the Saturday. We had a gift for you, a framed certificate of appreciation. And I looked up, Ron was gone. I said I was gonna call you, but I was so busy. I ain't had time to mess with you.
I had some honeydew stuff I had to do.
I could tell. I was eavesdropping on the phone. You was like, I be done.
But
That's the only reason I didn't bother you. I said I ain't gonna cause Ron no problem.
Yeah,
He
you
got
know.
to go home after this.
happy life, happy wife, right?
Absolutely, do it.
That's what I'm trying to do. Trying to stay happy. It's hard though, Kim. It's hard.
Hey,
So I think you had an excellent meeting today. Jennifer has some good information.
yeah. Now you see why I kept wanting to get that data.
Yeah, I
You
see.
know what I'm
I
saying?
see what.
Because people who can help, they need that. They don't need all this philosophical conversation. They need the numbers they can look at.
Right. You're right. Absolutely right.
That tells people how they can explain what they doing. You see how April was like, oh, okay, here we go, right? So that, I'm still